Good afternoon, everyone. My name is Michael Grice. I'm here with Adapt Productions, and today's guest is Kira Meskin.
Hi, Mike. Thanks for having me.
Glad to have you. This is going to be a very interesting show today. Kira, tell me about yourself, your professional life.
Sure. I'm originally from New York, and I've been living in Chicago for over 11 years. I identify as a person with a disability. And so professionally, I have been working with children through adults with disabilities for over 16 years now, primarily in nonprofit and community-based settings, which I'm very happy and proud of. And I went to University of Illinois at Chicago, and I got my doctorate in occupational therapy. And so now professionally, I'm an occupational therapist. And for almost 4 years, I worked in the school system. And what I loved about that work was just getting involved in the social justice work and world of what we face as people. And now I have the pleasure of working at Progress Center for Independent Living. And there I serve as a community reintegration advocate, which is where I help people who are presently living in long-term care facilities, such as nursing homes or institutions, and help them get out of those settings and live in the community with the necessary supports that they need. And so that's what led me, through my work at Progress Center, has led me to the work we're going to be talking about today as part of the PPE for People with Disabilities Coalition.
And it's my understanding that you are one of the co-founders of a coalition.
Yep.
That provides PPE. Can you explain what PPE stands for?
Yeah, sure. So PPE stands for personal protective equipment. So that's equipment that helps protect us from bodily fluids and infections and viruses such as COVID-19, what we're facing today in our pandemic. Our coalition's name is PPE for People with Disabilities. Sometimes we say PPE for PWD for short. I am the primary co-leader of the coalition. Laura Van Poinbrook, as well as Kristen Bush, are also co-leaders. And we have some really great longtime disability advocates who are part of our coalition, which is something we're very much proud of. We intend that our coalition is ran by and for people with disabilities. And our mission has been to help access and distribute personal protective equipment, such as masks, like fabric masks, medical gloves, hand sanitizer, face shields, even body aprons. So we've been able to receive quite a lot of donations through our volunteer work in doing this, and have set up a way for us to be able to distribute this equipment to people with disabilities who live in Cook County and receive home and community-based services. So people who receive home services through state agencies, to provide those folks who are personal assistants who work for them, to make sure that both our people and the personal assistants and care workers who support us are protected as well during this time.
And the coalition also works with HSP.
Yes.
And what's been your experience working with HSP?
Oh gosh, I mean, through this work, we have just recognized an issue that has already been a problem, which is a major health disparity. The more we have heard from the people that we serve, as well as from personal assistants and medical professionals, there is a real concern and lack of response in terms of the way our state is responding to this emergency, where our concern is that people are not getting the necessary equipment that they need, and personal assistants have also not gotten the equipment that they need in order to meet the essential functions of their job safely. And so that's a big concern of ours. We feel as if this is a health equity issue, and that our frontline workers include personal assistants and the what we call consumers, the people with disabilities, are the employers of these services. They are in charge of their services, and so we very much look to follow a consumer-directed model where we are educating our people and providing them with the equipment that best meets their needs. And what we have found as we have been getting more involved in accessing and distributing this equipment is that just how much of a fragmented system we have at this time in terms of the state agencies who provide this Medicaid waiver service for home and community-based services, and that is an ongoing concern that we have.
How is the coalition getting the message out to the disability communities?
Well, that's a good question. Well, a couple of ways. That's definitely a work in progress. When we were initially looking at what the need was, we had created a survey, so what we call a needs assessment survey, to figure out what the issues are and barriers that our people face and the equipment that our people need. And through that, we were able to be able to communicate, reach out directly to these people. I think it's important to acknowledge when doing outreach, particularly for our community, is that oftentimes people face barriers when accessing technology. So it's important in our outreach that not only are we sharing the message through technology, which a lot of us utilize for information. So we have our own Facebook page. We definitely have been sending out emails to our people, but I think it's important to acknowledge that some people rely on using their phone to access information as well. And so we have been reaching out to people. We recruited quite a number of volunteers, primarily through the National Student Response Network, to do some outreach and learn their stories and provide them with some education. I will also say that we have been having conversations and meetings directly with the Division of Rehab Services, one of the state agencies who provides home and community-based services. And through our conversations with them, recently consumers were sent a text message, for instance, that they were able to receive medical masks and gloves at their local DRS office. And so that we see that as a good step in the right direction. I think informing our people and the personal assistants who work for them, there's been a real disconnect. And so we're trying to bridge that gap. We want to make sure that our people are informed about the services and rights that they have in receiving this equipment. So it is an ongoing process. We also published a newspaper article in the Chicago Tribune discussing this. And then also we're looking to do interviews such as this one to help spread the word about this issue.
Has there been any legislators involved in this process?
Sure. So I think our coalition's taking a couple of avenues. Right now we're engaging in quite a bit of public policy work, which has been really excellent in terms of the response we've gotten so far. We have met so far with Senator Laura Fine, Heather Staines, as well as Senator Julie Morrison. And so far the response has been positive. And in their support of figuring out how we can better include and prioritize our people when it comes to emergency response. It's still a process, but so far we have been able to get a positive response from the legislators we've spoken to, and we plan to meet with more. What's great about these three women is that they all serve on the Human Services Committee. And so that really is an issue that is and should be a priority for them.
How can the disability movement get involved with this particular coalition?
Oh, that would be great if we could get more people involved. Gosh, I was going to say there's a few ways of getting involved. I don't want to say type of people, but we certainly welcome people who are interested in learning more about this issue or are passionate about this health disparity that we're facing and challenging, and someone who really wants to advocate with and behalf of people with disabilities. I think that this is definitely an issue that hasn't gotten enough attention. So the more involvement and attention that we can get to this issue, I think the better we're able to address it. So we really welcome people who are interested and passionate about ensuring that our people are able to live effectively and safely in the community. Ways in which to get involved. Well, you're welcome to volunteer for us. We will be, next steps for our public policy work is to gather stories of people who utilize home and community-based services. And so that would be a great way to help with us. We also have weekly meetings to discuss the logistics and issues that we're strategically addressing together. The way in which you're able to connect, there's a couple ways. So just to explain, while we do have this coalition that involves a variety of individuals affiliated with a number of different organizations and groups in the community, Progress Center for Independent Living is a partner organization of our coalition, which we're very thankful for. And you're welcome to reach out to their office, which is located in Forest Park. Gosh, I don't know if I have the phone number memorized. It's
708.
Yep.
209. 1500.
Yep. 708-209-1500. You're also welcome to reach out to me personally on my email. Again, my name is Kira Meskin. So it's KiraMeskin as in Nancy. And my email is kirameskin@gmail.com. So you are welcome to reach out to me that way as well. Either way, I will get your message. And I'm happy to discuss our work further with you.
Can you point out a couple of long-term goals for the coalition?
Oh, that's a good question, because we were just working through that question ourselves, because our coalition, our path has shifted quite a bit. Originally, our main focus was to work on solely the access and distribution of personal protective equipment, and that was all through grassroots efforts. What we found through that work is there is this need for engaging in more public policy, and as we've been challenging various barriers, what we've learned is that there's a larger issue at hand here, and we've come to realize that the emergency management plans, for instance, the Illinois Emergency Operations Plan and various local emergency management plans, do not include people with disabilities. And so that to us is a larger issue that we look to address. So our long-term goal is to make it so our people are actually in these documents and are effectively prioritized by our state agencies as a result.
What can people with disabilities do if their local doors office is not willing to work with them regarding PPE?
Sure. So DOOR stands for DRS, which is Division of Rehab Services. So our understanding is that if you receive home services through DRS, again, that just happens to be the state agency we've been focusing on, but working with. So if we're very much interested in understanding what your experience is when you reach out to your local offices, and whether you're having an easy time to be able to get the personal protective equipment, or you're having a difficult time. I think it's important for everyone to know that right at this point, you have a right to access these services, and that right now you should be able to be able to receive KN95 masks and medical gloves. Again, if you're having difficulty with that, like such as the office isn't calling you back or they're not providing you with adequate equipment, you're welcome to reach out to Progress Center. Right now, again, we had originally our distribution was very grassroots. It actually was located out of the garage of my home because we needed it to be a safe space. And at this time, we've actually been transitioning our equipment and supplies over to Progress Center for Independent Living for them to serve as a distribution site. So our mission at Progress Center is to also provide this equipment for you. So if you're not able to get the equipment from your DRS office, you're welcome to reach out to Progress Center as well. And we're happy to provide you with that equipment in addition to what you even receive from DRS or other ways. We're happy to support you in that way. What I will also say is that it's important for us to hear your story. Again, part of our public policy work is to gather stories from people, because us understanding your story is a great tool for advocacy, especially when we're talking to legislators. So we're more than happy at this time to learn more about what your experience has been during the pandemic, and your experience with your home services program at this time. So you're welcome to just call us just to share your story as well. We'd appreciate it.
Let me see if I have any last questions. So, where does the actual PPE come from?
Oh, that's a good question. So I would say at least 99% of our equipment has been solely donations. So we have gotten equipment from Illinois PPE Network. And this is, again, I'm saying this also as a big thank you to Illinois PPE Network, Get Me PPE Chicago, and Get Us PPE. Those are 3 groups of people who've provided us with all the equipment I've listed to you: masks, gloves, hand sanitizer, face shields, reusable body gowns. It's been really helpful. We've also gotten individual donations. So while we're not necessarily able to, as a coalition, accept financial donations, what people have chosen to do is purchase equipment for us and then donate it to our cause, which has been very helpful. And we're still accepting donations at this time as well.
That's all I have for this particular show. So, Kira, I'd like to thank you very much for being on today's show, and it was very informative.
Oh, thank you. I mean, really, this is my pleasure, and thank you for helping us spread the word.